Hey dear learners, I hope you all are doing great. Let us discuss about Nicotiana Tobacum, that is the tobacco plant. We have been discussing about cardiac poisons and you can check out the playlist in order to know more about them. These are the pretty flowers of Nicotiana tobacum, but action, the consequences that people have to that whomsoever organism had to suffer in the case they consume this plant are extremely harmful. It is cardiac poison, means it will ultimately be fatal for some or the other reason. Now, you must know that all the portion of this plant are poisonous. However, ripe seeds of this plant are not so poisonous in nature, means there is an exception to it. Dried leaves contain 1 to 8% of nicotine. Leaves contain numerous alkaloids. Some of them are nicotine, non-nicotine, and lobeline. That is Indian tobacco. In India, tobacco is consumed by most of the people, mostly who belong to the rural sites or people of laborers who are working people. They mostly consume tobacco. It works as some kind of stimulant, and then every cigarette deliver 1 to 3 mg of nicotine. Cigarettes also have this tobacco inside them, in some powdered form, in case you know that. So these are the leaves of the tobacco plant. In dried form they contain 1 to 8% of nicotine. Percentage of nicotine, percentage of alkaloid in the entire plant may vary from portion to portion. Then some of the properties of nicotine: it is colorless and hygroscopic. Hygroscopic means it has a water absorbing property. It is oily liquid and has some kind of burning taste, and it is also degradable in water. As I have already told you that nicotine is stimulant. Its major function is to stimulate the functioning of the body. So people who are mostly involved in job that involves more kind of physical labor, they consume tobacco. Why? It energizes them. Nicotine share its function similar like that of caffeine is present in coffee, so most of the time students consume it. Why? It helps them to keep awake, it helps them to study throughout the night, okay, without falling asleep. So these are some of the reasons why stimulants are consumed or administered in the body of the person. It keeps them awake, it helps them to work for prolonged period of time. Then it acts on autonomic ganglia. It initially stimulates the ganglia, so person might feel energized, but on the later stages, as the time proceeds, it will ultimately block the functioning and person might feel depressed. So at point it is stimulant, then later on it acts as kind of depressant. It also acts on somatic neuromuscular junction along with afferent fibers. Now, the common sign and symptoms that are observed in case of nicotine. First of all, you must know that some symptoms might be observed in case of acute poisoning, while others can be observed in case of chronic poisoning. The symptoms differ. It depends on the period where the dosage is being taken. In case of acute poisoning, CVS, cardiovascular system, tachycardia is observed followed by bradycardia. Tachycardia is a situation where heartbeat increases rapidly, means there is a condition of hypertension, whereas in bradycardia or hypotension situation, condition is just opposite, heartbeat decreases gradually, along with arrhythmia and some of the respiratory collapse or depression, means there will be increase and decrease of the heartbeat, along with some or other problems would be observed in your respiratory tract as well. Now, gastrointestinal tract: in case the poison is consumed, so burning sensation or acid reflux, some nausea, vomiting, abdominal pain, along with hypersalivation, increase in production of saliva, and odor of tobacco would be observed. Then to central nervous system, kind of restlessness along with confusion, then vertigo, sweating, confusion along with coma would be observed in the patient. Now some of the chronic poisoning symptoms include, first of all, in respiratory system, whooping cough and dyspnea, chronic bronchitis, would be observed. In worst scenario, in worst case, it can also lead to lung cancer. Hence, it is said that tobacco is injurious to health. In the packet of tobacco itself, this tagline is mentioned, but still people choose to consume it. Nothing can be done about it. Then, in CVS, cardiovascular system, person may observe heart palpitations, anemia, irregularity of heartbeat, and angina pectoris, means a heartburn. Then again, same symptoms, somewhat similar symptoms, vomiting, diarrhea, and anorexia. Then CNS and other, some blindness, person may observe tremor, the shakiness, and insomnia, sleeping sickness, anxiety, along with headache. Now dose varies highly from in just simple nicotine it will be 60 to 100 milligram, and for tobacco it is somewhat 15 to 30 gram. Fatal period is extremely lesser than any of the poison that we have studied so far. It is 5 to 15 minutes, means now you can assume that how fatal tobacco consumption is. Now, some treatment measures include gastric lavage with potassium permanganate, that is KMNO4, along with charcoal. Cardiac monitoring, regular cardiac monitoring and ECG of the patient is extremely mandatory in the case of nicotine poisoning. Then atropine is given often to correct hypotension, bradycardia, and diazepam is given for convulsion treatment. Then symptomatic treatment is given to the patient, mean treatment based on the system. Whatsoever system will be observed by the physician, all the managements will be done accordingly. Then some of the post-mortem findings include brownish froth of mouth and nostrils. Stomach may contain fragments of leaves or smell of tobacco. Now dried leaves are mostly found in the stomach of the patient in case the death has occurred due to the tobacco poisoning. Then features of asphyxia are also seen. Means breathlessness can also be the reason behind the death of the person. Some of the medical legal aspects include accidental poisoning. Accidental poisoning, the person may not be aware of the dosage. They might consume it in large amount, that can lead to death of the person. It can cause some heart palpitations or congestion of heart, congestion of your respiratory tract, and often leading to death or coma. Then ingestion and excessive smoking of leaves and juices, I've already told you. Application to wound or skin can also be harmful. Then common drug of addiction, tobacco is highly addictive. It makes the person, people will reach on the third sky, they will start working non-stop as it is a stimulant, so it enhances the working. People will automatically get addicted to it. In order to work for a prolonged period of time, they might consume it in a large amount without being aware of the consequences, as it is addiction, similar to alcohol, cigarettes, drugs, similar to like that. Then it can be used as suicidal, homicidal poison, but cases are extremely rare because it has certain properties which are easily detectable. So why would culprit use it for homicide? And in case of suicidal poison, there are better alternatives available in case people want to do that, so they might not choose tobacco as a mode of committing suicide. So this is it for the day. I hope you liked the lecture, and we have already studied about lots of cardiac poisons, from digitalis purpurea to Oleander, Nerium, and this is the nicotine plant. Thank you so much and keep watching the lectures.